Okay, let's explore Advantage Plans or Part C. What's the first step we do? Well, in my office, we go to Medicare.gov. From that, we go select, hey, I want to look at a current year plan. Hey, don't want to log in. Hey, what kind of plan are you looking at? Hey, and I forget if zip code comes first or plan comes first. Hey, I want to look at a Medicare Advantage plan. Hey, what zip code? You put in your zip code. Away you go. From that, you go to the drug screen, enter your drugs. From that screen, you go to the pharmacy screen, enter your preferred pharmacies, or even just some. Don't just get one. They allow you to have 5, so I'd fill that up. So you can say, hit submit, and then Medicare.gov ranks all the Advantage plans in your area that are available, whatever sort criterion you would like. If you'd like the one with the lowest premium and total cost, it'll sort those up for you, and so you can go through that. Okay, Advantage plans. What should you know? The first thing is, and don't make this mistake, but you've got to have your Part A and Part B. You can't not have that. If you don't have that, you're not allowed to sign up for an Advantage plan. And you know why that is, because that's how the Advantage plan gets paid. They get that money. So you've got to have that to be covered. Every plan, if a plan does offer drug coverage, it's all a little different. And so they have different formularies and different tiers. And so you've got to make sure. Some of them don't offer any drug coverage. So maybe you're in this and it doesn't offer drug coverage. And you say, oh, I'll just go get a prescription drug plan. That is not always available. So it depends on what type of Advantage plan it is. You may not be able to get a prescription drug plan. So you want to be very careful if the Advantage plan doesn't offer that. All plans have different copays and deductibles. So those are different. The nice thing is that all the plans, though, are required to have a max out-of-pocket for your Part A and Part B costs, the hospital, doctor's costs, and all that stuff, where it's the most that you're going to pay. It's called MOOP, max out-of-pocket. Every plan has that, so take a look at that. It doesn't usually Part D things don't usually count into that max out-of-pocket, but when you're investigating a plan, ask that question. All plans have their own networks, so some plans are really narrow networks, some are wide networks, some are PPO plans, some are HMO plans. There's just a whole myriad of things. So once you dive in there, know kind of the little differences there. And then they may offer other benefits. Some may offer dental, vision, and hearing benefits. Some may offer a gym membership. Some may offer an over-the-counter card. Those are all things that you need to consider. I think the last thing I'll leave with on Advantage plans, they're all CMS, Center for Medicare Services, I think is what it stands for, has a star rating for all of them, and it's out of 5 stars. So, and it's not subjective. It's all, there's all what people think of them and what providers think of them and everything else. So the higher the star plan, hopefully the better experience you'd have. But just remember they're rated, and you can always ask, hey, I would go with the overall star rating. They rate customer service and other things and have stars in there, but they'll give them an overall company rating. And that's what I would recommend you look at. Well, that wraps it up. If I haven't done a good job and you're still confused, what I would recommend is you either find a licensed agent that can sell Medicare plans. There's some senior aging centers that you can go to that can help with that. And I'm a financial advisor. I do that as part of my practice. Many financial advisors go through health specific stuff. They know lots of information about Medicare, they may be a good resource. So if you have a financial advisor, you can always ask them. But you should go ask for some help. It's an important thing. It should be a good thing. It's Medicare is great health coverage for reasonable prices normally. So just so you know. So thanks again. Have a wonderful day.